Hey, Dr. Jeff Williams here with Creekstone, and I'm your host of the amazing podcast called Chiropractic Forward. So you're in the right place. This week we're talking about acute and non-acute low back pain. What are the current health guidelines? Why does it matter to chiropractic patients and non-chiropractic patients as well? And why does it matter to those in the medical field getting and implementing the information? To start off the discussion, I'd say that one would be completely oblivious to not understand that chiropractic is considered to be on the fringe of healthcare by many or most in the medical field. I suppose it depends on where you're located. It's just a fact. In chiropractors, we have to deal with this every day. In other articles, I've covered the Wilk versus AMA case. I've covered the doctored film by Jeff Hayes that spotlights some of the mistreatment of chiropractors in the past. I've also covered current attacks on the Texas chiropractors by the Texas Medical Association. It's all very well documented at this point. In spite of these things, chiropractic is currently undergoing what I consider to be a pretty amazing renaissance. And I think this is due to a couple of key factors. The first being the need to develop non-pharmacological treatment recommendations in the midst of a national opioid addiction crisis, a crisis that has killed thousands and thousands in the last several years. The second reason being the body of high-quality research that is consistently coming to light almost every month, showing the effectiveness of chiropractic and evidence-based chiropractors. With all of the new information and new healthcare laws emerging, the questions going forward will be, is the medical field and is the insurance industry listening, and are they implementing? And we shall see. So far, the answer is absolutely not. In fact, it's almost defiant. But let's begin with the most glaring denial of federal law by the insurance companies right now, and it has to do with Section 2706 of the Patient Protection and Affordable Care Act, also commonly known as Obamacare. Section 2706 of the PPACA is entitled the Non-Discrimination in Healthcare section of the federal law, and is intended to keep insurance companies and health plans from keeping chiropractors and the services they provide out of the system. It reads as follows: a group health plan and a health insurance issuer offering group or individual health insurance coverage shall not discriminate with respect to participation under the plan or coverage against any healthcare provider who is acting within the scope of that provider's license or certification under applicable state law. This section shall not require that a group health plan or health insurance issuer contract with any healthcare provider willing to abide by the terms and conditions for participation established by the plan or issuer. Nothing in this section shall be construed as preventing a group health plan, a health insurance issuer, or the secretary from establishing varying reimbursement rates based on quality or performance measures. Whew, that was quite a quote. On the American Chiropractic Association's frequently asked questions site for 2706, they state the following: it is important to understand that 2706 and its assurance of non-discrimination in terms of participation and coverage requires that doctors of chiropractic not be discriminated against in the provision of any essential benefit that is within their scope of practice. Now here's the rub on 2706. Part of its purpose is to reimburse chiropractors performing the same services under their scope and license at the same level as any other profession that provides that same service. For instance, under the PPACA Section 2706 federal law, chiropractors are to be paid the exact same amount for a 99203 exam code as would be a doctor of medicine or a doctor of osteopathy, or a doctor of physical therapy is paid for that same exact code, plain and simple. But this is not happening right now. Chiropractors are not being paid equally for the same codes. With so many chiropractors now integrating their practices with medical directors, physician assistants, nurse practitioners, and physical therapists, It's painfully clear that doctors of chiropractic are being discriminated against when it comes to reimbursements for the same codes performed. In fact, chiropractors are integrating with these other professions just so that they can finally get those reimbursements that the other practitioners, they've been allowed for years. And it's madness. It clearly violates Section 2706 of the PPACA. Also, there's violation of the law if an insurer does something such as applying caps on specific services provided by one healthcare provider, whereas the cap does not apply to another type of provider. And it's my understanding that United Healthcare, for example, has moved to a $65 visit cap on chiropractic care here in Texas. It is the American Chiropractic Association's opinion that a violation exists if the insurer or plan denies specific forms of care that is otherwise covered if it's a chiropractor providing the service and it's within their scope and licensing. I'd suggest that a medical doctor likely gets services such as non-surgical decompression covered under insurance, or they could just call it traction and they get it covered under insurance, whereas chiropractors are routinely denied coverage for things like that. There's also a possible violation when doctors of chiropractic are denied inclusion into a plan or group purely based on the profession. For example, it's my understanding that First Care won't cover chiropractic. Is that a running awry of Section 2706? I'm not sure, but they cover medical services. There's a local insurance network here in my local region that charges $200 per year for chiropractors to be included into their umbrella of insurance companies. However, medical professionals, they don't have to pay anything to be included. Could that be a violation of the non-discrimination law? In my opinion, yeah. Federal law is being violated all over the place in regards to Section 2706. And I'm not sure how it can be perceived any other way, just to put it simply. Now, let's talk about some new recommendations for acute and chronic low back pain. I'd like to move on to the medical field's updated recommendations because I enjoy talking about it. It's becoming more and more aggravating that we chiropractors are not seeing a flood of acute and chronic low back pain patients these days. If you read my articles, you watch my videos, or listen to my podcast with any regularity, you have no doubt been informed several times over of these new recommendations. It's my opinion that no long-held beliefs or protocols are going to change if new information isn't continually pounded and yelled about from the top of the roofs. In marketing, experts, they've said that it takes a target 7 times of being exposed to new information before it's finally received and hopefully acted upon. I can tell you that the medical field has not been exposed to this information at least 7 times because of 2 things. I've spoken to several medical practitioners here locally, and not a single one of them had heard of anything like this. They weren't aware of these new recommendations. And number 2, I'm not seeing an incredible, overwhelming influx of acute and chronic low back pain patients that are coming through my doors as a result of medical referrals. Now, is this just willful disregard for the changing recommendations and kind of a clinging on to old dogmatic beliefs that were passed down from the AMA years ago? I think some of it, sure, absolutely it is. Is it that a few bad seeds in the chiropractic profession are giving the rest of us a bad image? I would say some of it most certainly is. I see it and hear it almost every day from my patients. Now, what I think it is mostly based on is the fact that medical professionals are busy. They're busy people. They're stressed, many times overworked, and they simply don't always have the time or opportunity to stay completely up on every single new recommendation or updated protocol that comes out. And with that being said, let's be clear. The issues of low back pain, its economic impact, and the national opioid epidemic crisis in America combine to make these new recommendations that much more important. So let's start with the American College of Physicians. Remember, the American College of Physicians was proven in the Wilk versus AMA case to have played a part in collaborating with the AMA in an attempt to rid the earth of chiropractic. I know that sounds dramatic, but it's the truth. I think that's important to note as we go through the information that the ACP is not a chiropractic lover. In fact, they've been historically a detractor. So that's why it's important. In response to the opioid epidemic gripping the nation currently, the ACP, the American College of Physicians, developed new recommendations for treating acute and chronic low back pain. And here's why they did it. The American College of Physicians developed these guidelines in order to provide updated recommendations on the treatment of low back pain. Now, with these recommendations, the ACP hoped to influence clinicians and patients to make the correct decision for care in acute, subacute, and chronic low back pain conditions. Here's how they went about it. They based the recommendations on a systematic review of randomized controlled trials and other systematic reviews, high-level research. The research they reviewed included those papers available through April of 2015. The research included only those on non-invasive pharmacologic and non-pharmacologic treatments. And here's what they found. Recommendation number 1, patients with subacute or acute low back pain should seek non-pharmacologic treatments such as, wait for it, chiropractic, massage, and acupuncture, as well as superficial heat before resorting to non-steroidal anti-inflammatories like ibuprofen, Tylenol, Aleve, etc. This was graded as a strong recommendation. Now, recommendation number 2, patients with chronic low back pain should seek non-pharmacologic treatments such as, chiropractic, exercise rehab, acupuncture, and cold laser therapy even, before resorting to non-steroidal anti-inflammatory such as ibuprofen, Tylenol, Aleve, etc. And this was graded as a strong recommendation. Now, recommendation number 3, this is the last one. In patients with chronic low back pain that have had no relief from non-pharmacologic means, the first line of treatment would consist of NSAIDs like Aleve, Tylenol, ibuprofen, etc. As a second line treatment, the clinician may consider things like tramadol and other similar medications. Opioids would be a last option, and only if all other treatments had been exhausted and failed, and even then with lengthy discussion with the patient in regards to the risks and benefits of using opioids. And this was graded as a weak recommendation. So strong recommendations, okay, were number 1 and number 2. So let's recap. In February of 2017, the American College of Physicians, historically a chiropractic profession detractor and attacker, now recommends chiropractic as a first-line treatment for acute and chronic low back pain. Pretty powerful stuff, folks. Next, let us discuss the American Medical Association. If you thought the American College of Physicians may be guilty of chiropractic hating, well, the American Medical Association is or was the Pablo Escobar or the El Chapo of the attacks on the chiropractic profession. The El Jefe, if you will, of the chiropractic haters. And the group that not only sat in the driver's seat, but also owned the entire truck of destruction back before Wilk versus AMA came along. I may or may not have been watching too much Netflix and came up with El Chapo and Pablo Escobar on my, don't worry about it. I'm taking addiction classes to Netflix currently, but I digress. On April 11th of 2017, the Journal of the American Medical Association published a study on their website titled Association of Spinal Manipulative Therapy with Clinical Benefits and Harm for Acute Low Back Pain, a systematic review and meta-analysis. This was authored by Neil Page, MD, et al. In the format of this research paper, they refer to chiropractic treatment as, instead of using the term chiropractic treatment, they use the term spinal manipulative treatment, or SMT. But because spinal manipulative therapy is what we chiropractors do the most and what we're most identified with, in fact, 90% of SMT, spinal manipulative therapy, is performed by chiropractors. Because of all that, I'm replacing the term SMT with chiropractic adjustment because I want to. Now, here's why they did it. Considering that spinal manipulation or chiropractic adjustment is a treatment option for acute low back pain, and that acute low back pain is one of the most common reasons for visits to the doctor's office, the authors wanted to systematically review the studies that have been done in the past dealing with the effectiveness as well as the harms of chiropractic adjustments in the treatment of acute low back pain. Here's how they went about it. The researchers used searches of databases called Medline, Cochrane Database of Systematic Reviews, Embase, and current nursing and allied health literature. The search spanned 6 years from January of 2011 through February of 2017 for randomized controlled trials of adults with low back pain comparing spinal manipulative therapy with no treatment or with alternative treatment. The accepted papers also had to measure pain or functional outcomes for up to at least 6 weeks. The data extraction was done in duplicate. The quality of the study was assessed through the use of the Cochrane Back and Neck Risk of Bias tool. And finally, the evidence was assessed using the GRADE criteria, and GRADE stands for Grading of Recommendations, Assessment, Development, and Evaluation. 26 eligible randomized controlled trials were identified and accepted, so 26 trials. Here's what they found. 15 of the RCTs, randomized controlled trials, totaling 1,699 patients, showed moderate quality evidence that chiropractic adjustments, had a statistically significant association with improvements in pain. P-A-I-N, pain. Man, we see them all the time. 12 of the randomized controlled trials, totaling 1,381 patients, showed, hold the phone, moderate quality evidence that chiropractic adjustments have a statistically significant association with improvements in function. No RCT reported any serious harms of adverse event as a result of undergoing chiropractic adjustments. There were only minor events reported, like some increased pain, some muscle stiffness, and headache, and roughly 50 to 67% of those treated in the large case series. I'd be interested to hear more about that last little bullet point that was made by the authors. A 50 to 67% minor event outcome estimation is nowhere near what chiropractors commonly see in our practices. Sometimes, if the patient is new, is not accustomed to chiropractic adjustments, they might experience some soreness or stiffness the next day, but that's to be expected following a change in the body. But numbers that large, they don't exist in most chiropractic practices, in my opinion. If we were making 50 to 67% of our patients sore and stiff and minor harms, we'd be out of business. It's ridiculous. So let's wrap this up. In true AMA fashion, instead of just coming out and saying, hey guys, we're the AMA. We used to hate you, and we still hate you, but we got to say, chiropractic adjustments, they showed moderate quality evidence for effectiveness in pain and function. So good job, guys. No. In true AMA fashion, the authors instead stated in conclusion, among patients with acute low back pain, spinal manipulative therapy was associated with modest improvements in pain and function at up to 6 weeks, with transient minor musculoskeletal harms. However, heterogeneity in study results was large. Now, heterogeneity is defined as the quality or state of being diverse in character or content. So in my opinion, this is pretty much to give themselves an out by implying there was not enough focus to the randomized controlled trials in order to truly state their findings as fact. But nonetheless, I'm going to say this. When the AMA comes even remotely close to endorsing anything having to do with chiropractic, I'll take it. And so should those in the medical field that commonly come in contact with those seeking help for their acute and chronic low back pain. You should take the advice. You should refer to a chiropractor. We should be all set for success now, right? It's all in writing. The research has been done. The recommendations have been made, right? Well, that's what one would think, but there's also new information from the White House that this simply is not the case, despite the obvious ramifications. On page 57 of the President's Commission on Combating Drug Addiction and the Opioid Crisis report, the authors say a key contributor to the opioid epidemic has been the excess prescribing of opioids for common pain complaints and for post-surgical pain. Although in some conditions, behavioral programs, acupuncture, chiropractic, surgery, as well as FDA-approved multimodal pain strategies have been proven to reduce the use of opioids while providing effective pain management, current CMS reimbursement policies, as well as health insurance providers and other payers create barriers to the adoption of these strategies. This is straight from the White House, y'all. At the bottom of page 57, you will also see that it says, quote, "The Commission recommends CMS review and modify rate-setting policies that discourage the use of non-opioid treatments for pain, such as certain bundled payments that make alternative treatment options cost-prohibitive for hospitals and doctors, particularly those options for treating immediate post-surgical pain." Yeah. Essentially, the United States government is admitting there is professional discrimination at the highest levels, meaning Medicare and health insurance plans, and that those create barriers to doing the smart thing. The smart thing is seeing a chiropractor for your back pain, people. The big guys, aka American College of Physicians and the American Medical Association, recommend it. And the government says policies are in place to prevent patients from following those recommendations. In addition, policies that discriminate against chiropractic or chiropractors run in violation of Section 2706 of PPACA federal law, so it comes full circle. How do we deal with this? How do we deal with it? It has to be either through the legislature at the state and federal levels, or it has to be through the legal system. A guarantee I feel very comfortable making is that the insurance companies will not begin enforcing it on their own. Mobilization and unification of the chiropractic profession and their patients is likely the reasonable first step. Now, here are some other steps toward that end, and they include join or get involved with your state association. They're the only ones effectively fighting for you and your rights on the state level. Join or get involved with your national association. The American Chiropractic Association is the only group effectively fighting for you and your rights on the national level. If possible, build relationships with your state and national legislators. Donate to all of the above in the largest amounts that you're comfortable with. Tell your friends and your colleagues about what is going on and help them get involved if they're so inclined. Next, follow the news of your industry closely and stay knowledgeable about your profession, both good and the bad. You have to know what's going on. And you must understand a chiropractic profession that is unified and playing offense instead of defense is powerful. And it's one of the worst nightmares of some folks I know out there in the world. And personally, on a side note, I like to see people like that squirm just a little bit. Don't you? So won't you consider helping if you haven't before? If you don't know where to start, email me at dr.williams@chiropracticforward.com. I will help you get on your way. Did you know? Research and clinical experience shows that in about 80 to 90% of headaches, neck and back pain compared to the traditional medical model, patients get good or excellent results with chiropractic. It's safe. It's more cost effective, decreases your chances of surgery, reduces your chances of becoming disabled, and we do this conservatively and non-surgically, and we do it with minimal time requirements and hassle on the part of the patient. And if the patient develops a preventative mindset going forward, we can likely keep it that way while raising the general overall level of health. Please feel free to leave us a comment, Tell me what your thoughts are. I'd love to hear what you think. And remember, sharing, I believe, is caring. Share. We can't make a difference without your help on this. Be sure to find us on social media sites like Facebook, Twitter, Google+, Pinterest, LinkedIn, Snapchat, and Instagram. There's so many of them. Also, be sure to subscribe to our YouTube channel. The link is in the description, or hit the subscribe button below. At the very least, can we talk you into giving us a thumbs up? Just tag that thumbs up right now. A gesture that simple and quick really does help us get in front of more people looking for this kind of information. And be on the lookout for our podcast called Chiropractic Forward. I believe we're in episode number 10 this week, and we're having a blast. You can find us at chiropracticforward.com or on iTunes podcasts. You can go check out my personal office at creekstonecare.com while you're at it, surfing the interwebs. And if you like more research-related blogs, check us out at amarellachiropractor.com/blog. Till next time, thank y'all so much for watching. Tell someone you love. We'll see you next time.